Welcome to the 11th Johnson's Baby Sense Seminar. The seminar is done in association with our media partner, yourparenting.co.za. Most complicated items in your home come with an instruction manual. You need a license to drive a car, a license to fish, and to own a TV set. But bring a baby into your house, and you are thrown in at the deep end. Sister Ann Richardson, the co-author of Baby Sense, will now be sharing some Newborn Baby 101.
Welcome everybody, and it's really just such a beautiful afternoon. I've just been sitting outside and I was very tempted to just say, glass of Sauv Blanc please, and not come back. But here I am. Can we just have a show of hands who was here this morning? Okay, so about half the audience. Okay, we will definitely touch on some things that we have talked about, but that's nice and good learning for us all. Okay, right, so I'm going to take you through what's going to happen in the first 6 weeks of baby's life. Please don't be frightened by what we are going to talk about. Okay, it's not going to be terrible. It's just going to be the most amazing, wonderful journey. Right, so your perception is that it's going to be just this wonderful journey and it's all going to be wonderful and marvelous. But of course, the reality is that you are going to really hit a couple of sort of bumpy paths along the way. But hopefully, you're going to go home armed with some good knowledge. All right, so first thing that we have to do, you're obviously all here because you're pregnant and you've accepted that your life's about to change. And as that lady says, funny thing, I used to stay up all night by choice and call it fun. So everything's going to change very, very greatly from now on. But of course, the prize and the whole fantasticness of it all is that you're going to have your precious little bundle. Okay, so the first thing that we're going to have to start dealing with is dealing with your baby's umbilical cord, which is the physical connection between you and your baba. Right, so, but it has to be cut. So when your baby's born, that is what your baby's cord is going to look like. It's going to be this sort of white, glutinous, globby thing with a big steel forceps on the end. And you're going to be quite sort of frightened of it, but don't be frightened of it. But it does have to be cleaned. This is what a cord looks like once the stump is actually off, and I will show you how that comes off. So you can use surgical spirits, you can use healing wound powder. Just use whatever your midwife has told you. You can use both. You can use spirits or the wound powder. You just want to make sure that you put in the spirits here, in the corner, in the actual stump, on the actual stump. It's kind of like a bit of a snotty bit there. And just don't put the spirits on the healthy skin around it, because otherwise baby's skin will get red. Your baby's going to cry quite a bit, not because he's sore, it's because spirits is cold, and because you're opening him up and it's cold and he's going to cry. So it's not painful, so don't worry about that. Obviously, if any of the skin around there gets red hot and swollen in your baby's mizzies, you need to obviously get that baby seen by somebody. Okay, and you can cover the stump with a nappy. But Huggies have got these wonderful nappies. I'm sure you've seen outside. They've got a little cutaway, and it's just absolutely perfect for that cord to fit around. So there, let's have a look, and let's see. That is what they're going to put on the cord after they take the forceps off. It's a plastic clip. Just make sure before you go home that they take this off, because this cord gets really dry, like a really good lekker piece of biltong. And you won't, unless you've got an angle grinder, you won't get that thing off until the cord falls off. So just make sure, in all the excitement of going home, that that plastic cord clamp gets cut off. Okay, so there's a little piece of biltong. That's what your baby's cord's going to look like for up to 3 weeks. Okay, some babies, the cord falls off very quickly. Other babies, it can take up to 3 weeks. When it comes off there, it may bleed a little bit. So don't worry if you see a little bit of blood on baby's nappy. And as true as Bob, it will happen at 2 in the morning when you open it and you'll see a bit of blood. And, well, you certainly, please don't phone me about that, at 2 in the morning. So that's that little piece, and then it's going to then fall off. So that's the first thing, the first connection that we sever. Then the next thing is that obviously we need to actually now feed this child. So we know, obviously, that breast is best. And unless you don't have the mechanics to actually breastfeed, there's no reason why you shouldn't give it a go. We know about how fantastic it is for antibodies, for immunity, and I just wish I had another whole day to spend talking to you about how important breastfeeding is. If you've had breast ops, whether going bigger, smaller, or whatever, you might battle to actually sustain enough milk supply to feed baby. But please, just because you might have had previous breast ops, it doesn't mean you cannot breastfeed. Every drop of breast milk is absolutely crucial. You can do mixed feeding down the line. Obviously, we don't advocate it at all. But obviously, if your baby isn't growing and your baby needs to put on weight, and with careful consideration with your healthcare provider, sometimes we do need to do extra feeds. The only time you never ever want to do mixed feeding, so that is formula feeding and breast milk, is if your baby is HIV positive. That is not recommended at all. You have to either do exclusive breastfeeding for at least 6 months or exclusive formula feeding. Okay, right, and it's free. That is just, for me, the bonus of breastfeeding. Buy shoes, rather, much more important. You really will need quite a lot of support, and you might be lucky. Some people, it just comes really naturally, and babies latch and suck and get on with it. And other babies, really, it takes a while for the fit to kind of work together. So you need to find someone who you trust, whether it's your mother, your sister, a friend who might have breastfed, a lactation consultant. Just find somebody who you can work with and who talks your language. And you will need a bit of support, but I am going to talk a little bit more about that. So really, just to make sure that your baby's tummy is conducive and ready to actually start drinking something other than fluid, is to really make sure, obviously, breast is best. That milk is just absolutely perfect. If you are formula feeding your baby, you need to be sure that your baby's on the right formula. And there are plenty of different formulas out there. So please speak to your healthcare practitioner, find yourself a good clinic sister, and really just go on your healthcare practitioner's guidance. A probiotic, we talked about this earlier, the bifidum bacterium component of the probiotic. You all know what a probiotic is. It's good bacteria. Now, our babies that are born by C-section don't get that ingestion of the good bacteria that Mother Nature gives us in the natural birthing process. And why we've got it and why the baby gets colonized with that good bacteria is to assist healthy gut function. So if you are having a booked C-section, or if you have to have one later, just remember, get a probiotic and give it to your baby that contains bifidum bacterium. It really assists very, very nicely with ensuring optimal gut function. Avoid overfeeding. It's very easy to overfeed a breastfed baby because the tap never gets switched off. It's just this infinite drippity, drippity, drip, whereas if you're feeding a baby out of a bottle, it's a finite volume. So it's very easy to use the breast as a comforter all the time. And sometimes that may backfire on you in terms of sleep. We heard about that earlier, but it often backfires and babies actually feed too much, and then it's literally like when you've had too much pudding and you kind of feel a bit sick and a bit nauseous, often a cause of discomfort. So just remember to separate your calories from your comfort. In the beginning, I would recommend demand feeding for at least the first 2 weeks, and thereafter, offer your baby many, many alternative methods of calming. And of course, we need to just be patient. Babies' guts are incredibly immature for the first 12 to 14 weeks of life. We know that our babies' brains, we know that our babies' guts, and we know that our babies' skins are very, very sensitive. So a lot of the colicky symptoms, I know Megan's talked at length about colic, and I'm going to cover it as well, are often related just to pure immaturity and nothing else. So just be patient. Things will get better. We always say you should be pregnant for 12 months. Sorry, moms, especially those of you who are 9 months pregnant now. You don't want to be pregnant for 12 months. So feeding issues that might come up now is difficulty in latching and sucking, and there's nothing more disempowering when you've got this little baby who's really starving and you can't seem to get the baby to latch and to suck correctly. So it might be something as simple as the fact that you just happen to have very, very big nipples and you've got a little baby with a little mouth. It's kind of not a great goodness of fit, but it will get better, particularly when your breasts are very engorged and very full. And that usually happens when your milk comes in. It usually happens on about day 3 post-birth. So the first 3 days, your breasts will be really soft and you'll panic and you'll think, I haven't got milk. But your baby, that little bit of that drippity, good colostrum nourishing milk, your baby just needs 5 to 10 mils a day of that to sustain in those first few days. Then suddenly you will wake up in the middle of the night and Dolly Parton has been to visit. And you've got these huge, big, throbbing breasts full of milk because Mother Nature gives that to you. But it can take up to a week for your baby's demand and your supply to kind of eventually pan out. So if you've got huge, big, very, very full breasts, don't panic. Whatever you don't want to do is express after your baby's fed in order to empty your breasts, because then your breasts will think, oh, I'm feeding twins here. So we'll make even more milk. So you'll be even more engorged. So it'll be fine. Just take it easy. Okay, so obviously if we've got an engorged breast with a huge nipple and a tiny mouth, there might be a few latching difficulties in the beginning. But just be patient. It will work out. Obviously, prem babies and tiny babies, they have a very, very poor sucking reflex, so they often need a bit of time to kind of find first gear. Thrush and reflux. Thrush is a Candida, which is a fungal, and I don't know whether any of you have ever seen it in the baby's mouth. I'll show you what it looks like just now. It looks like you've painted the inside of baby's mouth and cheeks and his palate with yogurt. So it's a white curdled a fungus, and that obviously will make your baby miserable and not want to actually suck. So that could be a possible reason. Reflux, if your baby's feeling a bit nauseous and got a bit of indigestion, which probably half of you have all got after those scones at lunchtime, your baby will be a difficult feeder. That is very often a very diagnostic thing for us to actually diagnose reflux, is if we have fussy feeding and babies who sort of chop feed, chop on, chop off, not nice feeding. Winds and gas, that stands without reason. If your baby's needing to have a big fat poo or has got a big fat fart on board, he's going to be interested in farting, not eating. So that, just wait for the winds to go. Overtiredness, I'm going to talk about at length, because fussy, overtired babies won't want to latch. They will fuss and they will perform. And then a tongue tie, which I will show you a picture now. That is what a tongue tie looks like, and it's very, very often missed in our babies that don't latch very nicely. What it is just a tiny little piece of skin that's attached at the bottom of your baby's tongue, and it goes, that's a very severe case. But your baby, the tongue can't go out to actually start feeding. So sometimes we just quickly snip it. It's very, very easy to do. In the old days, midwives used to keep their little nails long. So as the babies were born, they would just go across. It's very friable tissue. Mostly wear and tear. Literally just from sucking and whatever, it eventually just softens on its own. But if your baby's a poor feeder, look for this. Okay, that's what Candida looks like. Okay, that's the thrush, and you often see it, obviously, if we could look inside, it's usually on the cheeks and on the palate there. So not to be confused with a milky tongue. And all babies, once they're fed, have a little bit of a milk residue on their tongue. You don't need to clean that off. A lot of old wives' tales about how you must get glycerine and you must get this gel and the next gel, so you clean your baby's mouth after each feed. It's not necessary. Your baby's mouth has got lots of good bacteria in his mouth in order to keep the bad bacteria and the fungi away. And definitely if you are using like chemical sterilizers and you then put for dummies and then you put it into the baby's mouth, it can upset the bacterial flora of baby's mouth. And whatever you never, ever want to do is put your baby's dummy in your mouth and then put it in the baby's mouth, because mouths are dirty places. Right, so mastitis. This is something that might pop up, particularly in those first few weeks as the milk's demand and supply all pans out. And generally what it's caused by is a blocked duct here in the breast tissue. And you will know, because you'll be able, even with your eyes closed, to say, that's where it's sore. And you'll look in the mirror and you'll see there'll be a red hot area. It's usually the size of about a sort of 1 rand coin. So that is literally just the milk that's caught in the duct, and you need to just massage it. You don't want to express too much to empty your breasts, because remember, you'll just make more milk and the duct will block up even more. So a very easy way, you do not need antibiotics. You only will need antibiotics if that blocked duct becomes a breast abscess, and you will know all about that. So treatment of blocked ducts, very common, easily managed. You want to hot towel your breasts or heat your actual breast tissue before you feed. So just put a face cloth in the microwave, or rinse it out with really hot water or a little beanie bag, and you put it on your breast. You let baby feed. A lot of old schools that when you got a blocked duct, you mustn't feed because then the milk is sour. Just on that note, there's never anything wrong with your baby's milk. It's never too sour, too sweet, too thin, too thick, undernutritious, whatever. Never. There's often a quantity problem. It's never a quality problem with breast milk. So please continue to feed. And then after you feed, you put cool on, ice pack. So a little pack of peas, into your bra, and a cabbage leaf really works well. So keep some cabbage leaves in your fridge, pop them in your boob. Your house will smell of cooking cabbage after a while, because the heat from your breast will actually cook that cabbage. And see, all the dads in the audience are like going, yeah, but I promise you, it works. And you just would replace those cabbage leaves on a frequent basis. What really works well is anti-inflammatory medication. And that works beautifully to get rid of the inflammation in your breast. So a painkiller will obviously help with the pain, but it won't help with the healing. And there's lots of anti-inflammatory medication that is safe to breastfeed. So just ask your clinic sister. Okay, so the food has gone in, and we've obviously trying, we know breast is best. And then now comes the whole burping scenario. And there again, there's also, everybody's got their 2 cents worth about the best way to burp. And all I can say is that you will eventually work out what's the best way to burp. Some babies really are quite, they sort of gold star people, what's the word, you know what I mean, Oscar awards. Okay. Other babies never burp. Some of them just fart and not burp, others burp and not fart, and some don't do any. So if nothing's happened after about 5 minutes, abandon burping. Okay, you don't need to sit for hours and hours waiting for that burp to come out. The best way generally is just to let your baby sort of hang over your shoulder here. It's a very natural position to be in. Okay. Right, so now we have to deal with what goes in, what comes out, and now we get on to the poo talk. Okay, so in the beginning, you will be all arms and legs, and it will take you 2 hours to change one nappy. And as you've got the one side on, it's all pouring out the back, and you'll be very ham-fisted in the beginning. And that's okay. You've never done it before. So practice makes perfect, I promise you. So just know that if your baby has got a poo nappy, he's not going to die of his poo nappy. So rather just be organized and have everything ready before you actually unveil that nappy, because then there's just going to be poo and wee everywhere. Just remember, if you're at your friend's home who hasn't had a baby yet and lives in this sort of lovely bachelor pad, don't throw your baby's poo nappy in his kitchen rubbish bin, because that won't go down very well. And wash your hands afterwards. In fact, you should really make it a rule that every person who comes into your home to visit your baby must wash their hands first. That's the first port of call. We know that hand washing is the single best effective measure to prevent infection. So hand washing, and let people call you neurotic. It's fine. You're not being neurotic. You're being sensible. Okay, right. So That is what your baby's first poo is going to look like. It's called meconium. It's black and tarry, and there is a lot of it. Yeah. So don't panic. It's normal. And it's quite sticky, and it sort of sticks to the skin, so it'll need quite a bit of washing. But after about 48 hours, the meconium poo is gone. And this is what it looks like thereafter. So yellow scrambled eggs, mustard, squishy poo there. And there's always a lot of it. The good news is that if it's a breastfed poo, it never smells. And that's the best part. It's not a horrible, noxious thing. I know it looks like it, but it's not. And breastfed babies can poo. The rule of thumb is kind of 1 in 7. So he could have 7 or more poos in one day, or he could have 1 poo in 7 days. So breastfed babies don't necessarily need to poo all the time. But generally, in the first at least 2 to 3 weeks of life, every single nappy will be a poo nappy. You won't know what a wee nappy looks like. They'll all be this sort of scrambled eggsy thing. If you've eaten a whole punnet of berries, expect that poo to be red. Same thing with spinach and things like that. So don't get a fright. Just think back to what did I eat that could possibly be making babies poo. These little, you see those little those little things here? That is undigested lactose. Lactose is the sugar that's found in milk, and there's an incredibly high percentage of lactose in breast milk because it's sugar, it's carbohydrates. That's what babies need to grow. But some babies don't have enough of the enzyme lactase, which digests lactose. And that's why our newborn babies are a bit farty, crampy, pooey. They're all a bit digestively challenged because they just don't have enough of that enzyme. So if you've got a baby, if your little baby's particularly windy and crampy, and you're seeing lots of these little korreltjie pippy things in his poo, just watch what you're eating in terms of your dairy intake. Often it's a simple thing of just cutting down on your dairy, and your baby's cramps disappear. And you'll be able to actually see that those little pips actually lessen in your baby's nappy. And just talking about poo and eating and all of that, you don't have to go on any fancy exclusion diets because you are breastfeeding. The general rule of thumb is that anything that makes you a bit windy and a bit digestively challenged, stay away from. And then there's your usual culprits, obviously, like if you're going to have a really hot curry, or you're going to eat a punnet of Brussels sprouts, or something like that, you can assume that your baby will then suffer. Okay, so, but it usually comes through in about, so what you've had for dinner will affect your baby's midnight feed within about 4 or so hours. If you've eaten something that doesn't agree with your baby, you'll know about it within those few hours. Obviously, any medication, alcohol, caffeine, and sugar, the usual suspects, try and avoid. Okay, so all babies also push and strain and grimace and go all googly-eyed and red in the face, and eventually a poo comes out. That doesn't mean that your baby's constipated or that your baby's in any sort of trouble. They're very noisy pooers, so don't worry about it. We only worry about a baby who hasn't pooed for a good couple of days, more a week, and who is miserable and uncomfortable with it. And eventually the poo comes out and it's a hard bokdrol. Then you know, okay, right, we've got a constipated babies, but very rarely do we have constipated breastfed babies. Okay, so little girls, how do we clean and cream, and what do we do, and how do we clean and all of that? So your little girl's vagina will be very red and swollen when she's newborn, and it will stay that way for up to 6 weeks. So this is a normal little girl's vagina. This white, creamy sort of discharge in there, that's not nappy cream, that's a normal creamy discharge, which all little girls have. You don't need to clean it. You don't need to open the labia and clean inside. You just leave it well be. And when you put the nappy cream on, you just put it around the bottom area where the poo comes out. You don't need to start with the nappy cream up here and end down there. Okay, it's just here, because you'll be changing the nappy 8 times a day at least. So there's never, and with our wonderful new generation nappies, they really don't get nappy rashes. So you just need to go down in one stroke, and that's where you need to go. And as I say, no nappy cream necessary there. Of course, little boys are a completely different animal, completely. So, right, sorry, dads. Yeah. And by the way, I must just compliment how many dads are in the audience today. I really think it's just fantastic. My husband wouldn't be seen near here. Right, okay, so you always need to just have a spare wet wipe or a piece of cotton wool because you want to cover that. Because you're going to take the nappy off, and that penis is going to come up, and he's going to just spray. He'll wee back in his face, he'll wee in your face. He'll wee everywhere except where he's supposed to be. So just be organized. Just cover the penis before exposing the anal area. It's very easy to do that. Just simply like that. Okay, then the cleaning and creaming. Same thing with little boys. You only need to put the cream around the anal area. The penis doesn't need cream, the scrotum doesn't need cream, and the folds, there to there, no cream. Just here, around the bum area. Okay, so just a tip is when you put your little baby boy's nappy on, just point the penis down. If you put the nappy on and the penis is pointing up, your baby's going to be soaking wet across his chest. And I have so many moms and dads who come to me in the clinic and say, they can't understand why their baby's always wet here. And they hadn't thought about just pointing it down. And I promise you'll get into the hang of it. It'll be like second nature. Little cloth over the penis, pointing it down, vrip, vrip, tapes, and off you go. Okay, just a tip for you. Okay, so you may choose to leave your baby uncircumcised, or you may choose to circumcise your baby. If you don't circumcise, that obviously is an uncircumcised penis, and you don't have to do anything with that foreskin. You don't have to pull it back. You don't have to clean inside it. You often see, just like little girls have that white creamy discharge, it's not in this picture, but you might often see a white creamy discharge just there on the top of the actual penis. Okay, so just wear and tear will sort that foreskin out, and every clinic visit, your clinic sister will check it to make sure that it's all doing what it should do. And generally, by about the age of 7 months, the babies have found it themselves, and they do it themselves. Right, okay. So, a circumcised penis, your doctor will give you healing instructions to do, and he usually sends you home with a little tube of cream and a little dressing. It's like a little gauze dressing, and it's very easy to clean, and it'll get soaked off in the bath once a day, and you just apply it on the actual wound area where the foreskin has been cut away. As the baby heals, it takes about a week to heal. There might be yellowish kind of secretions coming off where the actual fresh wound is. That is normal. That's just the skin de-sloughing. So it's completely normal. But should your baby's penis and his scrotal area become very red and hot and swollen, and your baby's fractious and he's running a bit of a fever, you really need to get your baby seen to by a doctor. Okay, so that's the nappy region. Now we need to go on to the bath, the first bath. So if some of you are lucky enough to have gone to very good antenatal classes where they are teaching you with dem baths and things, they will also teach you in the actual hospital how to bath baby, but it'll all just be such a blur that you won't really kind of remember much. But all I can say is that you really need to just enjoy bathing your baby. There are no rules about where to bath your baby, how to bath your baby, or how often. So whether you use the cooler box or a basin, newborn babies are little, and you can bath your baby in your bathroom basin for a good few weeks. You don't need anything fancy at all. You may choose to bath your baby twice a day. You may only want to bath baby once a week because you're a bit scared of this thing, and it's okay. Just go with it. How dirty can a newborn baby get? But having said that, they really enjoy a nice warm bath, and it's a really nice bonding session. Babies often cry as you undress them because obviously it's cold, and then they go and they cry like blazes, and you put them in the water and they love it, and then you take them out and they cry, and it can all be very stressful for you. So just remember, he's not crying because he's in pain or you're doing anything wrong. He's crying because he's cold, just as you would be. I mean, how would you like just to be hauled out the bath before you're ready to come out the bath and sort of left dangling in the cold air? So if you can, a warmed towel and warmed clothing really helps. And if your baby hates going in the bath the minute you unwrap him, a good idea is to swaddle your baby in a little cotton towel and actually put your baby swaddled into the water and just let the towel sort of float away and then straight out the water and into a dry towel. Okay, so, and obviously from a skin, you'll work out what products work best for your baby. You'll work it out. I promise you, your baby will tell you. Okay, so now we've cut the cord, we've fed the baby, we've sorted out the burps, we've sorted out the poos, and we've washed the baby in its new clothes. So now, how do we really learn what your baby's trying to tell you? So we need to really learn to interpret our baby through their signals and through how they interpret the stimulation of the world around them. So we know that we've got 5 senses. There's actually 8 senses. There's a sense of movement, which is controlled in our baby's ears. It's the balance center. So every time you're moving baby up, down, or whatever, you are giving your baby a lot of brain stimulation. And as I mentioned earlier, when you're putting your baby to sleep or into his bed, don't put him head first. You will do that because it's instinctive to put the baby head first. But that might wake the baby up. So that's why you put the baby in the cot and then you've got the big eyes. And you think, but you've just fallen asleep. Why are you awake? So just put your baby down like that, not head first, just a little tip. So that's the sense of movement controlled in the balance center. Then you've got a sense called interoception, which is messages to your baby's brains. Do I need to poo? Do I need to wee? Whatever. So that is it only 5 minutes, Sarah? Oh, okay. Sorry. So that is a message to your baby's brain to say, I need to poo, I need to wee, etc. And then there's a sense called proprioception, which is messages to your baby's brain saying, where am I in space? Am I up? Am I down? Am I being swung? Or whatever. Lots going on to a tiny newborn space. So your little newborn cannot ignore sensory input. He can't do that for the first 12 weeks of life. So certainly the first 6 weeks of life, he won't be able to do that, and you're going to have to do that for him. So what happens is that from a very chilled, calm, sleepy state, the more stimulation that comes in leads to crying because your baby can't handle extended periods of awake time. So approach signals are when it's time to bath your baby, when it's time to feed your baby, when it's time to actually interact with your baby. And your baby will be relaxed, will be calm, the little mouth will be ooh, there's often eye contact, or a nice, happy sleeping baby. That's perfect. We all want our babies like that, but they don't all stay like this, unfortunately. So what happens is that as stimulation goes in, and that stimulation could be something from an air bubble causing a wind to somebody talking too loudly or wearing very, very strong perfume, your baby's then going to give you some signals to say, I'm not feeling so great about this. Just help me a little bit. And he'll start to fuss and squirm and wriggle and lose eye contact with you and start looking colicky. Okay, that is what newborn babies look like, by the way. So your babies are going to look like that. Don't panic. They do improve with time. Promise you. So they hiccup, they sneeze, they yawn. That blue round baby's mouth is a sign that they're tired, not that they've got a wind. That's an old wives' tale. The sneezing is a very sure sign in a newborn that your baby is tired. He hasn't got hay fever. He's tired. So you've got all these signs. They're in your notes there. And you've got your colic symptoms. So what do you do when your baby's crying like that? You try to make him better. And you faff and try and get that wind out and you just overstimulate your baby, and then you have a complete meltdown. So just be careful here, just to talk you through this. If your baby goes into sensory overload and is really overtired and fussy and crampy and colicky, whatever you want to call it, what happens to your baby's brain, and it happens to us as well, is that our brains get flooded with stress hormones in order to keep us going. So what happens is that you've got a baby who can't fall asleep because he's full of stress hormones. So you have to then do lots of rocking and holding and bouncing on balls and fragmented sleep. So babies who really just have short little cat naps and you're not happy, and everybody wakes up tired. So just remember that. Megan talked about the colic cycle earlier, and that's where it is again. So in the early days, the first 6 weeks, you need to make sure that your baby's not awake for too long. Anything longer than about 45 minutes, your baby's going to start getting tired and fractious and miserable and need to go to sleep. And you're going to need to fit in a feed, a bath, or whatever in 45 minutes. They don't need to feed in order to sleep, and they don't need to feed as soon as they wake up. It all depends when you last fed. So a sleep could happen without a feed, and a feed could happen without a sleep. Just remember that. Okay, right. So what do we do when we've got a fractious baby? Obviously, if it's a feed time, you've got to feed your baby. I mean, that goes without saying. You're going to swaddle your baby. I'm going to show you how to swaddle your baby now. And we're going to do something. I'm going to teach you something called my long arm swing. So the baby is going to be in the thing with the straps on. Very important. Okay. So, and what you're going to do, and this is great for dads and not for post-cesarean section mothers for the first 2 weeks. Can you all see? You're going to swing your baby like this. Long arm swing. Like this. And this is the most wonderful, quick, and easy way to soothe a fractious baby. And then just put a cloth over, because otherwise he'll think he's on the anaconda. Okay, and get a bit seasick. So that's the long arm swing. And you're going to do non-nutritive calming. So you're going to use dummies. I love dummies. Babies like to settle with their mouths and their midline, because that's where they were in utero. That's where they are in utero at the moment. They're not all over the place because of that startle reflex. You want to hold firmly, firm touch. Not tickly-wickly touch, because that arouses your baby. And you're not going to chop and change with 50 different methods to keep your baby calm. Just work through the wriggles and the niggles. So that's why babies need to be swaddled, because they've got this extremely strong startle reflex, which keeps them away from the midline and makes them wake up. So especially when you're wanting them to go to sleep. So we're going to swaddle. Dads, take note, because there's a test coming up. Right, so you're going to put the blanket quite high up on your baby, alongside the ear level. Okay? Hands to the midline. Very important. Okay, you're not going to straitjacket your baby. You're going to bring one side over. Okay? You're going to bring the other side over. Where is it? There. Like that. Don't tuck it in too tight. Give your baby a little bit of shoulder wiggling. Okay, next picture. And you're going to bring up the bottom. Okay, and there you've got your wrap. Who wants mayo on this? Okay, this is such an easy baby to handle because he's contained, he's easy to put up here, to burp or wind, to be put to sleep, whatever, compared to a baby whose arms and legs are doing the rock and roll. And you can even swaddle, you put your baby in its seat, and you can even use a car seat with your baby swaddled. Okay, very important. Okay, so just to run through a few quick ailments that your baby might get in the first 6 weeks and your panic, just to empower you on how to deal with it. The first thing is that your baby may get newborn jaundice. It's not infectious jaundice. It's not hepatitis like we know it. It's due to an immature liver. Very common. All our preemies become jaundiced. And there's really, your doctors will check the levels, your midwives will check the levels, and some babies need to go into some ultraviolet light. And good old ultraviolet light and sunshine just gets that liver working. So don't worry about that. Okay. A breastfed baby will stay yellow like this for up to 2 months after birth. Okay. So as long as your baby's thriving and growing and your clinic sister's happy, don't worry about it. A stuffy nose is very, very common in newborns because they have such tiny little passages here. So a milliliter of snot will goo them up at the drop of a hat. The best thing to use is breast milk to actually flush your baby's nose and eyes. And it really works well. Obviously, it'll be a bit difficult to kind of try and aim. So just while you're feeding on the one side, put a little cup or something so you can gather a few drops and a dropper, a syringe, whatever, and use that to flush your baby's nose. Okay, obviously, if your baby's got a fever and is miserable and is not wanting to drink, then your baby's probably got a viral infection, and you need to have that seen to. A sticky eye is always usually very concurrent with a bit of a blocked nose, and it's the blocked tear duct which sits here, and obviously everything just goos up. Breast milk as well works beautifully to clean sticky eyes. And just remember, when you clean the sticky eye, don't trail the goo through the eye and back again and back. You want to take a piece of cotton wool with either breast milk or saline, and you want to clean it halfway up the eye, and you discard that piece of cotton wool, and then you take a fresh piece and you take it through the other bit of the eye. And those little blocked tear ducts also can be massaged. The corner of your eye, just use your knuckle and just kind of grind your knuckle a little bit, and it often just pops out the goo. And that's a very, very common thing in the first 6 weeks. So this is just a simple recipe. There's lots of ready-made saline products out there, but you can make your own with a bit of salt and a bit of bicarb and a bit of cooled boiled water. We will put this up on the Baby Sense Facebook page for you. Right, so baby acne, very, very common, and it's always at its worst the day you're having the photo shoot or the day you're taking your baby to the office to show him off. It's usually hormonal. This is not eczema. This is baby acne. Okay, exacerbated by heat, most definitely. So keep your baby cool. What often works is just bathing that red inflamed area with a little bit of black rooibos tea. That really works very nicely, and it will settle only at about 4 months of age. If your baby's still got skin like this, after 4 months of age, it's eczema. It's not baby acne. Cradle cap as well, commonly known as cradle cap. It's also known as seborrheic dermatitis. It's literally, this is a very bad picture there. It's not always like that. It often just starts off with a dry, scaly scalp, and it won't go away on its own unless you actually treat it. So you need to make sure you have rinsed the shampoo out of baby's head really well. And that's the reason why cradle cap is often on the top of the head, because your baby's got a little soft spot there where the skull hasn't fused yet. It takes up to 18 months. And so you're a bit nervous to rinse it out. So the shampoo sits there and it becomes a bit dry and a bit scaly. Baby oil works beautifully. You wash, you rinse, you put lots of baby oil on. In the morning, you just comb against the grain, and you're able to just lift that off. It takes about a week, and you'll eventually get it off. You don't want it to ever look like that. Okay, a moderate nappy rash. All babies do get nappy rashes from time to time. This is nothing to worry about. It could be something as simple as your baby just having a good sleep at night, maybe for 6 hours or so, and lying in a bit of a poo nappy, yay, hallelujah. Or something like changing a product, changing a brand of nappy, soap, or whatever. You'll work out what your baby is irritated with and what your baby isn't. Sunshine usually just works perfectly, and a change of product. But this is a nappy rash you do need to be worried about, and this is a Candida or a thrush nappy rash. So often your baby's got it in his mouth, and then you see it, and it's manifested by these little red spots, and it needs treatment with an antifungal cream. This will not go away on its own. Okay, so that definitely needs to be seen to. Okay, vaccination. I wish I also had 3 days to talk to you about vaccination. Really important. It's not negotiable. Be guided by your clinic sister. There's a lot of vaccines that you can get for free at the state clinics, and our government has got a fantastic vaccination program. We're really fabulous with that. But there's a lot more that baby can have. So whatever vaccine is available, please take it up. Vaccines, we know, do not cause autism. They have very, very few side effects. And the very important thing, that I would really urge all you to do as adults, except obviously for those of you who are pregnant, but you can do it when you're breastfeeding, is get yourself a whooping cough vaccine. Because whooping cough is starting to show again. And we know it's because our immunity as adults is waning. And we need booster protection to keep our babies safe, our newborn safe. If a newborn baby gets whooping cough, it's not very nice. Your baby's really sick and can die. So please just remember that. Speak to your gynae or your clinic sister about the whooping cough vaccine. Right, so in conclusion, I'm just going to share a few little secrets with you. I know you all probably got a bit of post-traumatic stress syndrome after those nappy pictures, but you'll soon be real old hats. So have clear expectations about parenthood. It's a wonderful journey you're about to embark on, and you're not going to sleep through for a good couple of months. You might be lucky, but life as you know it will be different.
Mothering is our highest calling and hardest work. For the high and lows, Baby Sense is with you on your journey. Thank you for nurturing and touching the future. We would like to thank all our sponsors. Without their support, it would not have been possible.